we extended our current restrictions by a week and broadly outlined our Forward Virginia plan. That is our phased approach to restricted operations for businesses and limited gatherings that we will implement in phases over time based on data and science. We will provide more detailed guidance on those phases and restrictions on Friday. We continue to work with businesses and workers to ensure that there is confidence in the next steps when we take them. We're also working with our localities. I know that across Virginia, our localities are being affected in very different ways. I want everybody to understand, when we do detail what Phase 1's restrictions look like, we regard that as the floor. If local governments, based on the situation in their own localities, feel that they need to maintain additional restrictions on gatherings or business operations, we will allow that, and we will work with the localities. So we are talking to localities, including in Northern Virginia, to discuss those issues. I want to emphasize that we are closely monitoring the health metrics as we proceed, and decisions that we make are dictated by that data. A few weeks ago, I said we needed 2 weeks of decline in numbers to move forward with Phase 1. That is based on CDC guidelines. We are seeing that, and I hope we will be able to enter Phase 1 next Friday, the 15th of May. But we will continue to closely monitor the data to make that decision, as we do with all of our decisions. As a reminder, here's what we're measuring. We're looking at the percent of tests that are positive. We want that to be steady or a downward trend, and we are seeing that. We're looking at hospitalizations due to COVID-19. That is stable. We're looking at our hospital's capacity of beds and of ventilators, and that also remains stable. We want to have an increasing and sustainable supply of PPE, and for the last few days, no hospitals have reported having difficulty getting PPE. And finally, we want to have an increasing ability to test and trace. We're significantly increasing our testing, and we plan to hire over 1,000 contact tracers. Health is and will continue to be our first priority. Our next steps depend on our testing, tracking, and ability to quarantine. So I want to highlight some of those efforts. On the Eastern Shore, we continue to be concerned about cases in the poultry plants. Our health department is working with the CDC team as we speak. The two companies are conducting large-scale testing for plant workers, and we should get those results in a few days. The health department is going to be testing in the Eastern Shore community as well in the coming days. To increase testing, we don't just need kits. That's certainly an important part of it, but we need the people to perform those tests and to send them to the labs. For that, we've been partnering with our Virginia National Guard. The Guard provides the manpower and the logistical expertise. Recently, the Guard has helped with 12 testing events in communities like right here in Richmond and over on the Eastern Shore, and in congregate settings like Sussex 2 Prison. Under the federal Title 32 status, the federal government is helping pay for this assistance. We have this status through the end of May, but it is clear we'll continue to need this help. So today, I'm asking the President to extend this authorization. The National Guard regularly provides assistance in emergencies, and this is the greatest emergency that we have seen in many years. I am grateful for the service of our National Guard members. They are our neighbors, and they are also our friends. Today, we are pleased to have with us Major General Timothy Williams, the Adjutant General of Virginia, to explain more about our Guard's activities around COVID-19 in our communities. And again, before he takes the podium, these are men and women that are serving us so proudly here in the Commonwealth of Virginia. And so if you see one out in the neighborhood, out in your communities, please thank them for all that they're doing. Major General.